I have to say, in talking with the county executive's office, they say you've put a great deal of effort and time into getting this right when it comes to the reopening plan and doing it safely.
Yeah, and I think it really warrants a little bit of historical perspective and understanding where we were a couple of months ago on Monday, March 16th, when we announced we would be temporarily closing our operations. Before the state had even announced that casinos were going to be closing, we unilaterally did that. And on March 17th, began working on a plan to reopen, and working on a plan in conjunction and partnership with the Department of Health, the Oneida County Department of Health, Madison County Department of Health, because it's not, I think one thing we've learned is that there are no islands here. If there isn't coordination and there isn't open communication with public health officials, with counties, with the local, regional municipalities, it doesn't work, right? I mean, you cannot isolate this unless you're the NBA and you want to put everyone in a bubble. But
right.
That's not, that's not the norm. So we've done a number of things. I think we've now been open just about 2 months, and we are very cautiously optimistic about the actions we've taken have been effective. And our response to that isn't that, okay, now we can loosen up, but rather kind of the opposite. We know what we're doing is working, and we need to stay, consistent with those actions. And the things that we are doing that we feel have been, the most impactful, obviously start with face covering. That is our number one way to stop the spread of the virus. And that, when we had our face covering policy in place in June, that was before, I think, conventional wisdom was everyone should require it, right? I mean, Vegas opened, and they weren't requiring it. We saw that as a critical piece of our health and safety protocols. We have a very, very extensive contact tracing program that we do with the counties. I mean, I think people need to understand the process. What happens is when a person tests positive for coronavirus, the county departments of health in which that person resides are automatically notified of that testing, right? So it sets into action a contact tracing program that we have been doing in conjunction with the counties, where we contact trace our employees. Now, we're very proud of the fact that we, in the 2 months that we've been open, and literally have had hundreds of thousands of people through our doors at all 4 of our properties now, we don't have one bit of evidence to suggest that anyone has contracted the virus from our property, right? And we know that because of our contact tracing program. We've had people we have had employees who've gotten it from family members, and then, they subsequently came in, but have had a mask policy. But even with the mask policy that we have, if we determine through our contact tracing program that any employee has spent more than 10 minutes within 6 feet, which is the CDC requirement, then we will automatically, even if that employee has not tested positive, put that employee on mandatory,
14 days. Yeah.
So yes, CDC has actually moved it back to 10 days, but we've had it at 14 days. So we have currently, more than 50 employees who have not tested positive. Now, the people we've put out, we've determined through our contact tracing program were exposed to within, 10 minutes and 6 feet.
Yep.
Not one of them has tested positive that we put out on leave, but we're still doing it. It's still our policy because it's working, and our employees understand it and appreciate it. I think our guests understand it, appreciate it, and everything that we are seeing suggests that it's working. We also have a screening process for our employees where our temperatures are taken every day. We've caught some people who've had high temperatures, sent them home. We have a no questions asked policy. If a employee isn't feeling well, they're automatically sent home, right?
Yep.
It's made running our operations challenging, but this is what we're doing, right?
Yep.
And on top of that, we're still not having concerts. Our nightclubs aren't open. We have physical distancing in our restaurant. We're operating at about 50% capacity in our restaurant. So it is, we've had to make significant sacrifices, but obviously, worth it because we're, set on long term here.
Right.
So have you, do you screen players, guests as they come in?
We screen in terms of, in the beginning when we first opened, we had a 120-mile radius.
Right.
So we screened to make sure you were from within that radius, and we screened to make sure you have a proper face covering. Now we've since subsequently adopted the state's policy in terms of the 31, 32 states that are on that list. Anyone from one of those states, we just don't allow into one of our properties. Obviously, we can't tell if they've been quarantining for 14 days so we just made a decision not to let them in, which is, impacted certainly our number of visits, but we've erred on the side of being conservative, and we require face coverings everywhere. So that those have been the actions in terms of what related to our guests.
The state's policy as it relates to other states, that's replaced the 120-mile radius restriction, or is that still in place? Okay. It's replaced it. Okay.
And Andrew with a question.
Yeah, we had a listener call up to ask about social distancing policies on the gaming floor. Maybe that in some instances people at various tables were a little bit too close to one another.
So we have a 100% mandatory face covering policy on the gaming floor. And as a result, when we did have it at Turning Stone, originally when we opened in our smoking area, we had physical distancing there because people obviously weren't wearing masks. We subsequently went full non-smoking and have a 100% face covering requirement so that, that we don't have physical distancing requirements where face coverings aren't possible, right? So in our restaurants and bars, we have physical distancing gaming floor because of the face covering requirement. We do not. And like I said, the one thing, we know that we have not had anyone contract the virus from the property. We have no evidence to suggest that yet. So that policy has been working. Now, we've been very fluid. We've adapted it. We've made changes. Like I said, we've changed the non-smoking and smoking policy at Turning Stone. So if we feel that certain actions are required, it's been a fairly fluid process. But at this point, we think what we're doing has been effective.
Is the smoking restriction, is that because obviously to smoke you'd have to take your mask off?
Exactly.
Okay, do you see that non-smoking maybe something that sticks around?
Well,
at this point you don't have any choice, right? With masks.
I'd say for Point Place Casino, YBR Casino and Sportsbook, and now the Lake House, all of those are non-smoking properties.
Right.
And Turning Stone, I'd say about 90% of the property is non-smoking. We had one area of the gaming floor where smoking was permitted. So, by and large, we've had most of our properties have gone non-smoking. I would say also one of the advantages that we've had at all of our properties is we have a very extensive, sophisticated air filtration system, our HVAC system. We circulate air way above what's required, or what's at least suggest that. I mean, we're turning over the air. It's almost than being outside, right? So that's how, and we're bringing in fresh air from outside and turning that over at a very high clip. So I think that has been another effective tool for us to mitigate the spread.
I have about a minute left. I just wanted to say the numbers are really telling their own story because you guys opened up in June and you've released some of those distance restrictions. And we're looking at our lowest numbers in Oneida County since this whole thing started.
Yeah, and everyone's committed to it. I think that's really a credit to Tony Vicente, who has been just a outstanding leader in this and understanding that, prioritizing health and safety while in a very measured, conservative way reopening the economy. We know, as the largest employer in Oneida County, we have a unique role that we play in keeping the county afloat economically and in a way that's smart. We can't afford to screw this up. There's too many people, our employees, the county, the businesses that rely on us, who need Turning Stone and Oneida Nation to stay open, keep people safe, and keep operating. So that is not a responsibility that the nation takes lightly, which is why I think you've seen such close coordination with the counties and such an adherence to these protocols.
Joel Barkin, I appreciate the frank talk and taking the time with us this morning. Thanks so much.
Thanks, guys.